Well, this week, the Bears made it official that 2015 top draft pick Kevin White will not be on the field for the foreseeable future. The leg injury that hampered his training camp turned out to be much worse than expected, a left shin stress fracture. Now comes the obstacle of healing, and our friends at Midwest Orthopedics at Rush believe that the Bears medical team is keeping the future of their young prospect in mind.
Tough, but things happen. The sport. It's not going to be all sunshine every day, so got to roll with the punches.
From the dream of being a rookie wide receiver of the Chicago Bears, Kevin White is now living the reality of possibly missing his debut season in the NFL. Dr. Charles Bush Joseph of Midwest Orthopedics at Rush is not White's doctor, but he has certainly seen his share of stress fractures in athletes.
With his diagnosis, which is a stress fracture of the tibia, the primary treatment is always non-operative. You let them rest, give them every chance to heal. So I'm sure that in this situation, Dr. Bowen and Dr. Neuber prescribed electrical stimulation and all these non-operative things that we have for treating stress fractures. But at the end of the day, it's either going to heal or it's not. And if it doesn't heal, then you've got to surgically intervene. And if you surgically intervene, the player's typically out for an extended period of time, anywhere from 8 to 12, 14 weeks. In Kevin's case, I would assume that Kevin's fracture occurred more up in the anterior part of the cortex. And usually if you have what we call the dreaded black line, so on x-ray you can see a break in the front part of the bone. This is the area, this is the Sam Bowie fracture that heals very poorly and many times has to have intervention or surgical intervention either with a plate and screws or by drilling a hole in the bone and placing a titanium rod down the bone.
The 22-year-old wideout had participated in light workouts throughout training camp with no forward progress. For the Bears, the season is approaching and the show will go on. And the challenge now for Kevin White is accepting the terms of his rehab.
Assume we got a compliant patient who's metabolically supported well and has all appropriate supplements and blood levels of the critical factors. Number two, he's been compliant in terms of the non-impact approach to treatment. And then number three, the imaging studies show no element of progression to healing, time to intervene, time for surgery. If the Bears have a great season and we're playing week 18, week 19, week 20, yeah, he may be able to contribute. But, if the season's over at week 17, then it's better off not risking the 2016 season. Shut them down, let them train in the off-season, let them slowly build up a stamina and slowly build up strength in that bone so that this doesn't happen again.
Very interesting stuff. Well,